So now today our topic is about ECG, which is electrocardiography. I am discussing here only the review. I am not going in detail. What is ECG? This is graphical representation of electrical activity of the heart. So whatever our heart electrical activity will do, this will shown on a paper in graphical form. This is known as ECG. As we know, from SA node the electrical signal will generate and it will pass to the AV node and then to the complete heart. In ECG we have 10 electrodes, 4 limb electrodes and 6 chest electrodes. Remember, electrodes and leads are different. We have 10 electrodes and 12 leads, but firstly we will see which are our 10 electrodes. So 10 electrodes divided into 4 limb electrodes and 6 chest electrodes. 4 limb electrodes are, there is a mnemonic to remember that: read your green book. There will be 4 electrodes. One is red, second is yellow, and third is green, and fourth one will be black. So read your green book. It's like you have to arrange them in the same manner. From read there is red, so red will be on the right forearm, yellow on the left forearm, green on the left leg, and black on the right leg. Remember here these electrodes. Now you can see the picture also down. The metallic side will be on anterior surfaces of the forearm or the legs. The metallic side, when you open the electrodes you will see. I am saying for the 4 limb electrodes. Okay, now red, yellow, green and black, these are 4 limb electrodes. What about 6 chest electrode? These are V1, V2, V3, V4 and V5, same name like our leads. So 6 chest electrode, how these will be arranged: V1 at 4th intercostal space right to sternum, V2 at 4th intercostal space left to sternum, V3 at midway between V2 and V4, and V4 which will be on our apex beat location at 5th intercostal space left to sternum, absolutely, and medial to mid clavicular line. V5 and V6 also at 5th intercostal spaces. V5, where will be its location? At 5th intercostal space at anterior axillary line, and V6 at mid axillary line as shown in the picture. I am going in speed because we are not here to study about the details much, and only a review for the ECG. Now the main topic is how we comment on the ECG. So firstly, in short, we will see about the leads. How many leads? I already told you that there are 10 electrodes and 12 leads. So 12 leads, what is the difference? Electrodes are the dead parts which shown in the picture back, and leads are the picture view of the cardiac activity as shown below in the picture. These lines AVF and AVL, AVR, these lines, and this is the picture view of the cardiac activity. So the leads will show the picture view of cardiac activity. These 12 leads divided in 6 limb leads and 6 chest leads. What are the 6 limb leads? These are 1, 2, 3 and same like AVR, AVL and AVF. About the chest leads, same like our 6 chest electrodes. Now how to comment on ECG in the exam if you receive, or in the Viva? How to comment on ECG? Representation of the leads. V1, V2 and AVR will show the right surfaces of the heart. Lead 1, V5, V6 and AVL will show the left surface. Lead 2, 3 and AVF will show the inferior surface. You can remember AVR as the R is coming to the rights, and V1, V2, lead 2, V5, V6 and AVL will show the left surface, 2, 3 and AVF will show the inferior surface. So where is V3 and V4? This V3 and V4 will show anterior surface of the heart, which will help us to diagnose the posterior wall myocardial infarction. Now, how we can see the posterior surface activity of the electrical activity of the heart? There is special lead which you have to put inside the esophagus, also known as the esophageal lead. So mostly we didn't do this. Now, when you see a paper of ECG, you can see here paper of ECG is moving at the speed of 25 mm per second, and one big square will be equal to 5 small square or boxes, and one big square time is about 5 mm. Okay, for one big square is equal to 0.2 second. In simply you can say, if one big square is about 0.2 second, then how much will be one small box or one small square? It will be 0.04 second. Now P wave, QRS complex and T wave, we already know P will show atrial contraction, QRS complex show ventricular contraction, and T wave for ventricular relaxation. How to comment on ECG? You see an ECG, first you have to tell about the rate. How to calculate the rate? Just see R waves, peak of the R waves from one R to the second R, or you can say R to R interval. So how many big boxes or big square came from one R to the second R? You have to divide these big square by 300. There is formula for the heart rate. Heart rate is equal to 300 divided by big square between one R to the second R. Let's see for example, we have 4 big square or 4 big boxes. So how much will be the heart rate of the patient? This will be equal to 300 divided by 4 is equal to 75 beat. And if you see 2 square, that will be equal to 100 beat per minute. Now I will show you the lead to calculate how many big square in this ECG and what will be the rate. Yes, here is about 4 big square, so the rate is about 75 beat per minute, which is normal. Second thing is rhythm. Lead 2 is known as the rhythm lead. Mostly we use this lead. This is about 6 second long strip for this lead. How we can calculate the rhythm, or how we can see the rhythm? Okay, mostly you just by seeing you can see the rhythm is normal, because there is no no far distance between the R waves. When you see R waves from the QRS, we have paper method. If someone give you an ECG, take the ECG, okay, and take a white blank paper, mark 3 consecutive R wave from the lead 2 on a paper card and check for their corresponding in other leads. As below picture is shown, there is ECG and the upper is paper, so you have marked with the red color for the R waves, and now you have to move this paper to the next part of ECG to see whether the distance is same, or the next R wave is coming before or the above to my marked R wave. So here you can see the rhythm. If there is same distance, that will be a regular rhythm, and if there is some difference in the distance, that will be irregular rhythm. So for now we will close here. Other thing we will discuss in how to comment on ECG is about axis, P wave, PR interval, QRS complex, QT interval, ST segment, and additional consideration in the ECG. Now from where the 300 is coming in the formula for the heart rate is equal to 300 divided by big boxes or big square between two R wave. So this 300 is coming, as I already told, that one big square is equal to, like, one big square speed is about 5 mm, and when you divide a paper which is moving at the speed of 25 mm per second, so 25 divided by 5, it will be equal to 0.2 second. Now how much we will be in 1 minute? 660 divided by 0.2 will be equal to 300. So that is the 300 from where it is coming. It is not concerned, just remember about the heart rate. How you will calculate? Heart rate is equal to 300 divided by how many big square came between two peaked R waves.